thing about breast cancer is it's such a variable disease. We encounter patients, even in our BrainMet trial program, who, might have only been diagnosed with early breast cancer in May, and then by June or July the same year, they're already enrolled in our BrainMet program, indicating that for them, it's been a life-changing, rapid journey from primary cancer diagnosis to a terminal metastatic diagnosis, all within a few months. Then at the other end of the spectrum, we have women who might have received their first breast cancer diagnosis in the 90s, and they're coming now, through our metastasis research program. And, that indicates how different the journey can be for different women. I don't envy either of them. The woman who has undergone treatment for the last 20 years of her adult life, versus the woman whose life is completely turned upside down within a few months. It's always, really, really difficult, but it is just so variable. The bonsai study is really, really important. It's going to generate very important benchmark data that describes how drugs enter the brain metastasis space and are retained there. And what we're hoping to do then in the future is build on that baseline with brand new engineered nanomedicine type drugs, which is a very exciting area involving protein engineering, enabling us to specifically engineer features to overcome some of the barriers that exist to uptake of standard drugs. The bonsai study was initiated in 2019. It's essentially a phase 0 brain imaging study. And what we're aiming to do with that study is understand the relationship between perfusion through a tumour in the brain and the uptake of a monoclonal antibody into the tumour and how that's retained over time. The procedure for patients who are enrolled is that they come along to the hospital and they're infused with a radioactive tracer, a very safe tracer level dose. And after waiting a couple of hours, they'll then have a brain MRI. And it's actually a PET MRI hybrid scan. So we're able to overlay information about drug uptake with information about perfusion, that's the flow of blood through the tumour, and the anatomy surrounding the tumour. So we can get a really detailed data set that we can use to mathematically relate those two things. The patients will have a second scan after three days, possibly a third scan as well. And collectively, that's how we generate the data set used to really characterise how blood flow relates to drug uptake. The feedback that we've had from the patients enrolled in the bonsai study so far is that it gives them a sense of purpose. It helps them feel like they're doing something positive with their situation, and possibly even a distraction. Because they come through the HERF and it's interesting. We can explain, our research. They can also have a look around and, be distracted from their situation by thinking about something that's a little bit intriguing for a while. But mostly it's the idea of a legacy that, they're doing something helpful with their situation.